Hello friends! Welcome back to your favorite health channel. If you've ever been jolted awake by what feels like your big toe being crushed in a vice grip, you might be one of the millions of Americans living with gout. This often misunderstood condition affects approximately 1 to 2% of Americans, with numbers climbing higher among those of us over 60. What is gout, really? Imagine tiny needle-like crystals forming inside your joints. That's essentially what happens with gout. When your body has too much uric acid in the bloodstream, these sharp crystals can deposit in your joints, most commonly starting at the base of the big toe, causing intense pain that many describe as unbearable. The first time I had a gout attack, I thought someone had broken my toe while I was sleeping, shares Robert, a 68-year-old retiree from Ohio. I couldn't even let the bedsheet touch it. That's how sensitive it was. Why seniors are more vulnerable. As we age, our risk for gout increases significantly. After age 60, about 40% of us develop what doctors call metabolic syndrome, a combination of high blood pressure, excess weight around the middle, and changes in blood sugar and cholesterol. This condition dramatically increases gout risk. For women, the risk jumps after menopause when protective hormones decrease. For men, risk typically begins rising in middle age. And if you're African American, your chances of developing gout are nearly double that of other populations. Interestingly, gout has been known throughout history as the disease of kings, because it was associated with rich foods and alcohol luxuries once available only to the wealthy. Today we know the story is more complicated. The uric acid connection. Here's something important that many don't realize. About 75% of the uric acid in your body comes from your own natural processes, what doctors call internal production. Only about 25% comes from the foods you eat. This explains why simply changing your diet rarely solves the problem completely. It's like trying to drain a flooding basement by using a cup when the main pipe is still leaking. For seniors, this is particularly important to understand because our kidneys become less efficient at removing uric acid as we age. Many medications common in our age group can affect uric acid levels. Existing joint problems can make gout attacks more painful and damaging. When gout strikes, a typical gout attack often begins in the middle of the night. The pain intensifies over 24 hours, accompanied by redness, swelling, and skin that feels hot to the touch. Many patients describe feeling feverish, weak, and anxious during these episodes. For older adults, these attacks can be particularly debilitating. They may prevent walking or standing safely, increasing fall risk. The severe pain can disrupt sleep, which is already challenging for many seniors. Recovery may take longer than in younger individuals. After my first few gout attacks, I started keeping a walker next to my bed, says Margaret, 72, from Florida. Even getting to the bathroom became a major expedition. Beyond the big toe. While the big toe is gout's favorite target, it can affect other joints too. Knees, ankles, elbows, and fingers can all fall victim. In long-standing cases, deposits called tophi may form visible bumps under the skin, particularly on fingers, toes, and around the elbow or Achilles tendon. For seniors with existing arthritis, gout can be especially troublesome, sometimes making it difficult to tell where one condition ends and the other begins. Getting the right diagnosis. If you suspect gout, seeing your doctor promptly is crucial. While they'll consider your symptoms first, they'll likely check your uric acid levels and may recommend an ultrasound to look for crystal deposits. A word of caution for older adults. Approximately 30% of people with obvious gout symptoms may show normal uric acid levels during testing. This happens because the uric acid has already moved from the bloodstream into the painful joint. Don't let a single normal test reading dismiss your concerns if your symptoms match. The three-part treatment approach. 1. Taming the attack. When gout flares, anti-inflammatory medications are typically prescribed to reduce pain and inflammation. For older adults, it's essential to start treatment quickly, ideally within the first 12 hours. Be aware of how these medications might interact with others you take. Monitor for side effects, which can be more common in seniors. Consider alternative approaches if you have kidney problems or other conditions that limit medication options. 2. Prevention strategies. Learning to recognize your personal warning signs, perhaps a slight tenderness or warmth in a joint, can help you take preventive steps before a full attack develops. Your doctor can recommend appropriate preventive medications that may be taken at the first sign of trouble. For seniors, prevention becomes especially important as recovery from attacks may take longer with age. Mobility limitations during flares can lead to muscle weakness and deconditioning. Repeated attacks can damage joints already stressed by years of use. 3. Long-term uric acid management. The most crucial treatment approach is addressing the underlying problem by lowering uric acid levels in the blood. According to medical guidelines, this treatment is particularly indicated when you experience more than 2 attacks yearly, you have visible tophi, joint damage is apparent, you have kidney stones, your uric acid levels are extremely high, you can't tolerate treatments for acute flares. For older adults, consistent long-term therapy brings additional benefits, reducing inflammation that may contribute to heart disease, preserving joint function and mobility, preventing kidney damage, improving overall quality of life. The medication that lowers my uric acid levels has been life-changing, reports William, 75, from Massachusetts. I haven't had an attack in 3 years, and I can play with my grandkids again without fear. However, an important warning. When starting medications that lower uric acid, you might temporarily experience more frequent attacks as the crystals that have accumulated in your tissues begin to dissolve and move. Many patients get frustrated during this phase and stop taking their medication just when it's starting to work. Stick with it as this phase typically passes. Lifestyle strategies that help. While medications are often necessary, several lifestyle approaches can enhance treatment. Stay hydrated. Aim for at least 8 to 10 glasses of fluid daily to help your kidneys flush out uric acid. For seniors who may have a diminished sense of thirst, setting regular water breaks throughout the day can help. Consider vitamin C. Some research suggests that vitamin C supplements may help reduce gout attacks. Talk with your doctor about whether this might be appropriate for you. Watch your diet. While diet alone rarely causes gout, certain foods high in substances called purines can trigger attacks in susceptible individuals. These include organ meats, certain seafoods, and alcohol, particularly beer. Try cherries. Multiple studies show that cherries or cherry juice may reduce gout flares by up to 35%. Maintain a healthy weight. Even modest weight loss can help lower uric acid levels. For older adults, focus on gentle, joint-friendly exercise like water aerobics, walking, or chair exercises. Follow a heart-healthy diet. The DASH diet, originally designed for blood pressure control, has been shown to help lower uric acid levels as well. Special senior safety tips. If you're managing gout in your golden years, consider these additional safety measures. Medication awareness. Keep a complete list of all your medications, including over-the-counter drugs and supplements, to review with your doctor. Some common medications for high blood pressure, heart conditions, or even aspirin can affect uric acid levels. Home modifications. During a flare-up, everyday activities become challenging. Consider keeping a cane or walker accessible, using a raised toilet seat if lower extremities are affected, having slip-on shoes that don't require bending, installing grab bars in bathrooms, using a reaching tool to avoid bending. Pain management alternatives. If you can't take certain pain medications due to other health conditions, ask about alternatives like topical treatments, carefully directed cold therapy, or specialized footwear that reduces pressure on affected joints. Movement strategies. Work with a physical therapist to develop safe movement patterns during flares that won't increase fall risk or strain other joints. Communication plan. Ensure you have a way to call for help if a severe attack immobilizes you when you're alone. The good news. Despite the challenges gout presents, especially for seniors, it's one of the most manageable forms of arthritis when properly treated. With the right combination of medication and lifestyle changes, most people can effectively control their condition and prevent future attacks. Understanding your condition is the first step toward taking control. With proper care, you can continue enjoying an active, fulfilling life, keeping gout pain firmly in the past where it belongs. Thank you very much for watching. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell to stay updated on health news, and see you next time. The information provided in this video is strictly for educational purposes and should not replace professional medical advice. Always consult with qualified healthcare providers regarding any medical condition, diagnosis, or treatment options. Everyone's health situation is unique, and what works for one person may not be appropriate for another. Never delay seeking medical attention or disregard professional medical advice because of something you have seen in this video.